providers already, and some of you may want to know more about that. And then after that, I'm going to go more to my area of research, which has been loneliness. This sort of, I suppose, my academic area of expertise, you might say, which I've been doing quite a lot on over the years, often related to older adults, not just in care homes in this case. So I'm going to sort of go through some of the key findings from the several sets of research I've done in this area, which I think is fair to say it's an important area in home care and many parts of social care. I have got some slides, so I'll start sharing them now. I'm just going to share my screen, I think, and then sort of load them up.
Yeah.
So yeah, hopefully everyone can see those okay?
Yeah.
Good. So yeah, firstly, niche leads. Obviously, there's a lot of emphasis on leads there. But you can see at the bottom as well, it's quite a sizable partnership with several groups. And just to add as well, we do have a national care work partnership that we're part of. It involves people all around the country, and even we're part of something called the Living Labs, which is an international group of all different people that do work in social care and have very sort of personable approaches, I suppose you could say, where we, all the groups across Europe all have a similar model where we sort of consider it a collaboration of science and research and actual everyday practice and people in that as well. I'm going to go through a few slides in relation to that, but first, a bit more about me and why you'd even bother listening to me. You may not, it's up to you. For quite a long time after when I was a bit younger, I did work in care full time and also volunteered in a lot of mental health charities and campaigns. So I did have a lot of hands-on experience sort of in and around the sector in that time. Eventually decided I wanted to pursue research, so I actually did a part-time master's and continued to work in care for another 3 years before eventually one of my biggest sort of projects so far was a doctorate in men and loneliness. Not just older men, though quite a lot of it was focused on older men. So I'll be presenting a bit of findings about older men in particular, whichever group presumably sometimes you will be going to visit people in home care. I briefly worked at a place called the Centre for Loneliness Studies, and then another project called the Loniliness Project, which was actually trying to create a smart monitoring system for people who live at home, for older people who live at home. I wasn't there for very long, but I'll summarise a bit of what I learned about the use of technology and things like that in this area. And now Niche Leads, which we mainly focus on research into care homes. And my sort of biggest priority has been looking at loneliness in care homes. So I'll tell you a bit more about what I've done so far with that. But Niche Leads, as I say, a partnership between care and science. Excuse me. This is an older picture, so I'm not on it, but there's a few people involved there and a few examples of the groups that we are linked to. There are actually more than that now because this is an older slide, but and as I say, there are wider opportunities for people to get involved. In particular, we have a family and friends. I don't know if there's any family and friends of people in care here, but we have a family and friends group that meet regularly, and we meet with them to discuss research priorities and things like that, as well as to discuss the research we're currently doing. We also have groups in care homes where we will visit the care home or visit meetings much like this to sort of regularly catch up on research priorities, to discuss research. So why do we exist though ultimately is about enhancing life care and work in social care. That is the key reason for having this sort of partnership type approach. We want to make sure that the research we do is actually helpful, which historically maybe some would argue that hasn't always been the case. But as I've probably gathered from the way I've been presenting this, that is a key part of what we do. As mentioned, some of the people we work with is somewhat older slide again. We can see the COVID times, memories, the masks. But yeah, it's about working, and we do work with staff as well. I should have mentioned before, care staff are a key part of a lot of our work, and it's a very important part of the perspectives about what's important and also what's feasible, because sometimes, people who have, residents at care homes or people who receive care may have requests that actually are not so easy for staff, and it's about also sometimes bridging those things so we can find the best way forward for everyone. And then that's everybody is part of our research, and Leeds Council are probably the commissioner side, and the sort of the groups we mentioned before are also quite involved to get their perspectives. So it's a very sort of all-round approach. Yeah, as I say, this is how we work together. It was a bit I've sort of been talking about this already, but it's all about being people who are, work or live in and around care in general, whether that's family, staff, residents, commissioners, etc., being part at every stage of the research. So firstly, we build, we get research questions, we build engagement with research through doing things like what we're doing right now. And then once the research is carrying out, we have people who help co-produce it, or sometimes just look at it, whatever it might be for the particular thing we're doing. And ultimately, even once it's done, we keep involved. We build that engagement. We help build the impacts through these groups. And you can see here the photos. We've got the family and friends group in one, or some of them that were there that day. We've got some staff, and is with the staff. Right now, the research we're doing, there's actually more than this. There is quite a lot going on. You've probably noticed home care is one of the things on there. So to finish up with the sort of specific talking about niche leads, there is actually a project in that right now, a man called Stephen Parkin, who's one of my colleagues, who I don't know too much about this exact study, but I guess I think the general principle is to join up sort of health and home care services to make sure people are getting the best healthcare possible. If there is anybody here who wants to get more involved in that project, it seems like they are sort of wanting more people. So you could, I'll forward Melody or something the slides after this. You could contact Stephen here to ask more about how, or apparently ring him, he's put his phone number on, to how you could get more involved in that. But ultimately, this will be my main presentation. But before I go on to it, I just wanted to ask, does anybody have any questions about niche leads, or how you get involved, or how it works, or anything like that, before I move on to the sort of more research focused part of the presentation?
Right. So just to confirm again, so your presentation is going to be on the home and healthcare project, isn't it? Because I was going to ask more about that project. So if your presentation is already about that should be fine. Yeah.
Well, my presentation will be about my work on loneliness, because that's the thing that I mainly do. So the home care project, I'm not really involved with. But the general way of how niche leads works and how to get involved, I can certainly answer questions on, which I thought is well worth presenting, because we do, put the effort into trying to work with groups like yourselves, who clearly already do quite a lot, but we'd love to, get your views on things a bit more, rather than just listening to my presentation on this particular project about home care as well, because I know that Stephen's looking for people to get involved right now. So I just wanted to put that forward, that if anybody wanted to get involved with a different one to what I'm going to present.
Right. I mean, I'm sure we'll be happy to know as well about the home and healthcare project. We've got a few interns as well working with us. Probably they will be interested to know, and probably coin or turn their projects as well around that area. Or, I mean, it could be an opportunity to discuss further. I hope we can get more details on that.
Yeah, I mean, the thing to do would probably to email Stephen then, who's running that project. And mainly I think he'll be wanting people who are staff, or people who receive home care, or that kind of thing. They're probably the main people. But I think he'd be happy to take any questions from interns and things as well. I'm sure he'd be happy to hear from and see what we can do to sort of get involved together.
Yeah, sure. Yeah.
Yeah, if there's no other questions, shall I move on to the part my research, which has been about loneliness? And yeah, just before I put the slides back on, actually, I think the reason I've decided to print is about that is because it's what the vast majority of the work that I've done has been focused on. I haven't really had a project where it's been related to home care, but it has been related to older adults. So there's lots of transferable findings there. And if nothing else, I think it's interesting sometimes, especially because I used to work in care for a while. And I think just getting these little bits of information that people have really looked into sometimes can be just interesting, and just help you go about thinking about what you do and those sorts of things. So I'm hoping that's what it can bring today. And this, as you said, I'll be happy to answer any questions on that as well in a moment. Go back to sharing my slides. So yeah, loneliness in older people. As you're probably aware, for the sort of work that you guys have, it's quite a well-known issue, one that's been around for some time in many ways, but it's very much not been solved. Many ways, that's because it's a complicated issue. It's, on the one hand, it's very personal, and how to sort of prevent or alleviate loneliness is something that differs I think, in everybody that you might support. At the same time, it also requires input from other people, generally speaking. It often requires, good relationships to be built or to be maintained, and these sorts of things that sometimes that input from other people it adds a layer of complexity. When you add in home care, people are maybe losing their mobility, not able to get out as much anymore, perhaps losing their cognitive abilities sometime, or perhaps suffering from bereavement. There can be lots of issues that are causing this loneliness that you can't necessarily do as much about as you might like sometimes. So what I'm going to do today is go through sort of 3 areas of research that I've done quite a bit in relation to older adults and loneliness. Firstly, I'm going to look about the study I mentioned before about understanding loneliness in older men. I'm going to go a little bit into technological solutions related to loneliness. It's not as much, I haven't spent as much time on that, to be honest, but I think there's some lessons that could be interesting for you to think about. And also my current work, which is about interventions to tackle loneliness in care homes, which is not as, I suppose it's a bit more specific to care homes rather than the home care situation, but it's many of the situations that people face in care homes can be similar, the ones I've just mentioned for a start. So let's see where we go. Firstly, the loneliness in older men. I've sort of had 3 angles to my research, and I'm going to cover the conversation in 3 words. Firstly, I looked quite deeply into the statistics and found some quite notable things about how loneliness in older men can be, on average, a different thing to loneliness in older women. Not a deterministic to all men and women, of course, but those aggregate differences can help us think about what specific issues men might have. I also had, deep conversations, qualitative research, we'd call it, which is essentially just really getting men's perspectives about what they think, their experiences and that kind of thing. And then I'm going to think a little bit about what all this means at the end and what you could actually do to help loneliness. Firstly, those statistics, though, in some ways just interesting nuggets of information. The first one, it says there older men were less likely than older women to state they are lonely even when controlling for an indirect scale. What that means is the indirect scale is a way of measuring loneliness that doesn't use the word lonely. So it'll ask things like, how often do you feel left out? How do you feel you have enough companionship? These sorts of questions. And interestingly, you may have sort of come across ideas around your work that men are less likely to sort of open up about mental health issues, including maybe less likely to sort of seek help for feeling loneliness. And this, looking at this statistically, I very much found that even on a survey, men did not attribute their feelings, though negative feelings, presumably, well, definitely negative feelings, to loneliness. So when you're sort of dealing with older men, there's a chance that there is loneliness there, that they're not going to have that idea. They're not going to necessarily construct how they feel as being lonely. They might think about it a different way. One such thing, point 2, older men also showed a much greater association between loneliness and alcohol consumption. Older women, in fact, those that drank more alcohol were actually slightly less lonely than those that didn't. Whereas amongst the older men, the men, as you can imagine, typically drank more alcohol in general, but the lonely older men drank by far the most dangerous amounts, to be frank. And that is perhaps a sign that that is an alternative way of trying to deal with loneliness, rather than perhaps even saying, like in the thing, they're not going to, rather than sort of acknowledging, seeking hope for loneliness, they're turning to things like that in some cases. And again, statistical evidence of it. And I should say, actually, I forgot to say, this is from a data set of 7,000 men and women aged 50 and above across England and Wales. So it's not a negligible sort of amount of people where these are being found.
Yeah.
Number 3, severe isolation predicted greater loneliness in older women, as you would expect, but not older men, not at all, not even a slight increase in loneliness. It could be because men aren't as bothered by being isolated. In some cases, that's probably going to be true. They're also a sign, alongside the other findings, that actually they're especially the men that are the most isolated of all are probably the ones that are not sort of thinking of themselves as lonely. Perhaps they're not saying they're lonely is almost part of the way to deal with the severe isolation, but it doesn't necessarily make it a positive thing. So these are complex things. The fourth one, older men who cohabited with a partner were less lonely than older women who were usually married. In some cases, they were cohabiting unmarried, but the same sort of pattern tended to be the case. Um, on the other hand, older men who had lost a partner and they were either that and now were alone, so that was either widowed or divorced or separated, whatever it might be, they were much low. They were suffering from it much more than the female counterparts. The women definitely in that situation still felt lonely, but the men coped with it much worse. They went from being the least lonely group overall to, in this category, really struggling, being much lonelier than everyone else. So that's selling to us that amongst older men, especially those that suffer bereavement, those that lose a partner, separate or divorce, are a particularly likely to be a lonely group on quite a severe level. Last but not least, there did seem to be a reason for that in the data, which was that older men overall had a worse perception of their friendships than women. That is, they had a scale where they were asked to score several things that were related to how good they perceived their friendships, and older men's score was on average worse than older women's, and that seemed to be a key part of the reason for struggling more when separated. Theoretically, then part of the reason older men are more sort of, really struggle when they lose a partner is because they don't have as good friendships or don't perceive themselves to have as good friendship at least. So those that do have better perceptions of friendships will cope with that better. Those conversations I mentioned, different way of sort of doing the research, not the big statistics anymore, long conversations with men about their experiences, and backs up some areas of this. One of the interesting things that men often sort of constructed ideas of maleness and masculinity as responsibility, and loneliness was something of a negating, sort of renegating on that responsibility, not doing that responsibility to look after others. Instead, you're burdening others by being the lonely one. The reliance on partners, some men actually relayed stories of parents and things where their father had quite a one guy described his father's relationship with his mother as quite suffocating. Didn't say much more than that in these sort of interviews. There's also an idea of loneliness, again, going with it not being this positive responsibility thing as being this idea of being quite a subordinate position, a kind of, lonely old man stuck in front of the TV, quite idea that's quite negative, and they didn't want to be that person. There was quite a key effort to get away from being that person, even if they did feel lonely. And it's one man even actually did say, sometimes I feel lonely, but that doesn't make me a lonely old man kind of thing. So there's tendency to want to distance from that role. More positive things though that sort of prevented loneliness. I think the concept of social worth, or a kind of self-worth that's derived from the man's social position, was considered quite important. I've got a negative example of somebody who was still in work, who was really proud of the fact that they were a chef and what they created. And he said that one time he felt really lonely at one point after a person at work sort of mocked him for his caring about his job and being proud of it, and so saying, "Oh, he thinks he's Gordon Ramsay or something." And it was interesting. And there was lots of other similar tales to this about how having something that could afford a sense of self-worth but had a public sort of vibe to it was an important way to not feel lonely. Also, just having things to do was also considered important. Having that stimulation of sometimes it was social things to do, but occasionally it was things that weren't necessarily with other people. Things like gardening considered great for loneliness if they had the opportunity to do something. So, what all this means for tackling loneliness in older men in this case, I've got sort of 5 things here. Purpose and pride, and this was all about that, that social worth I was talking about on the previous. So, men that are able to volunteering was often a really good way of sort of getting involved in something that afforded not just social interactions, but that sense of worthiness. For men that can't really get about as easily, which some of people in home care would be supported by, reminiscing was a really good way to sort of remind people of past worth in part, and also to sort of get those interactions going and remember their sort of worthiness, and also ways to destigmatize the position that they're in now are also vital in this situation, because part of it is essentially about the loneliness is a stigmatized position. A bit of both of these activities. I mean, walking football, they'd have to be quite physically capable to do that one. Men's Sheds are a group you may have heard of, really sort of grew over the last 10 years across a lot of the world. And they're, if you don't know what they are, they're, how do I describe them? They have a sort of spot where they can essentially just go and just have some tools and get together, and then just get making things. Sometimes they make things for the community, like they might get together and create a bench or something. Sometimes people, they can be more welcoming you think for people that are not that physically mobile. They'll often have, as part of the just being there for a chat or just doing the little things, can be part of it. But that can be a really sort of good one that I'm sure there will be a men's shed around where you live somewhere, because they have grown quite a lot. The last three are a bit more about the sort of people that are likely to feel, or next two, sorry, who are more likely to feel loneliness amongst older men. And I think based on what I was presenting before, men who are heavy drinking, very socially isolated men, possibly lonely, but may not say they're lonely. If that is, something that you want to try and do more about, and ways to find them is worth considering. Men who have lost a partner as well, much more likely to sort of understand themselves as lonely. So there you can sort of think about things like support groups or targeted interventions to help with that loneliness of having lost a partner. Last but not least, a bit of safe space was considered quite important for interventions, including the sort of no pressure to be masculine. Despite the walking football and men's sheds where you think quite traditionally masculine things, there was a keenness for it not to be a pressure to have to be sort of manly. Even amongst, you might think that's more of a sort of liberal idea, I suppose you might say, but it was quite consistent amongst different groups and people of different political persuasions, that they didn't want things to be that way amongst older men anyway. And of course, ultimately, the same intervention won't work for everyone. It is complex in that way. But it's always a personal thing, and finding the right things for the right people is part of the difficulty of the task. I'll move on to some of the work on technology and loneliness. I realised that's not technology. When I got the picture, I thought it was a little robot, but it's not. Never. I apologise. I've been on 3 projects actually, very distantly related to this. I was briefly involved in something designing a virtual reality program for homebound older adults. Then there was the de-loneliness project I mentioned before, which I was on for 10 months. And then my current review that I'm doing now, the work in care homes, does partly look at technological solutions in care home for loneliness. I'm not going to go as much into this one, because I probably don't have the same knowledge base, but just a few things that I have concluded, to be honest, based on these different experiences. Firstly, a lot of older people may be more favourable to technological solutions and more, able to use technology than is sometimes assumed. There can be a bit of an idea that, and it's sometimes true that some older people aren't as capable at using sort of modern technologies, but there's definitely some that already can, some that are willing to learn in the right situation where they've got somebody to be able to tell them how to use it. So it's not something to necessarily just assume that they can't do these things. That said, whatever the technology might be, choice and control were key. A lot of the technologies are sort of video call technologies that you come across, and again, just being able to use them and just on their terms when they want to use them. The smart monitoring system for loneliness we looked at was about, okay, supposedly we tried to get something that could actually detect when somebody might be lonely, particularly useful for people who maybe not as verbal or confident as they used to be. They wanted to control, like, who was this sent to? Was it sent? Sometimes they wanted it sent to themselves. Sometimes they wanted it sent to a family member or something like that. Whatever it is, choice and control was always vital. Costs and challenges. There's definitely costs and challenges with any technological solution. It's always something to factor in. But as I say, it doesn't necessarily mean they shouldn't be. Last but not least, you might be thinking, detecting loneliness. That's completely crazy, isn't it? How is that possible? Based on the work we did, I think it is possible. We know that loneliness has a very severe impact, can have a severe impact on people's health. It's certainly a strong association between things like cardiovascular, having heart problems, even like early death is related to loneliness in a general statistical way. And this strongly, and we know that things like, spending time with people changes the neuropsychology of what happens sort of inside your body. So there's definitely things there where we know there is this component to loneliness that you could detect using technology. We're not there yet, though, to be honest. We didn't really on that project. I wasn't the sort of lead person on that. We didn't really get there, but just to mention, it's not as crazy as it sounds. Last but not least, loneliness in care homes. Obviously, I don't think any of you will have much to do with care homes, but hopefully I'll be able to sort of pass on some transferable information from what my current work is. I'm doing something called a scoping review of reviews. If you're part of what do you call it, groups that co-produce things, you might have heard of a scoping review already, but if not, it is about looking at all the sort of existing research. It's not really about comparing what's best as such. It's more about getting together everything that's out there. The reason we did it like this in this study is because there's quite a lot of research about loneliness out there already, but we don't really, and all of it, I mean, doing something, whatever you might do, tends to be useful. So comparing different types of research, not as useful. So it's like, okay, what exists? But importantly, what are the gaps and challenges in that? What are the things we don't know and would like to improve on? We've also got quite a lot of consultancy involved. So I've spoken to the family and friends group a few times that I mentioned. I've been to a care home and spoke to mostly staff turned up, to be honest, which was a bit of a shame, but these things happen. Then we also held an event a few weeks back where lots of, I think, a good 100 people came. This was residents of care homes staff, commissioners, some of the general public who were just interested because they had friends and family in there. And again, spoke to people there and incorporated that into what we're sort of concluding. This is essentially what we found. There was lots of social engagement activities. This is things like, essentially, you might do a lunch club or something like that. It's something where you go into you get people together to physically talk to each other. So it might be a lunch club. It might be you bring an animal into the care home and sort of discuss having this animal around. That was quite a common one, actually. It could be many things, but all with the key thing where you're physically getting people together. Therapies, though, were also quite common. So this is things where more focused on a person's actual feelings to feel better about their situation, even though loneliness has this potentially part where it's related to other people and their relationships to other people. This was still quite a common thing that was happening and did seem to sort of be effective as well, judging by the research. And call technologies were quite common, providing some kind of video call technology. Strengths and weaknesses of it did give people the chance to have a bit more opportunities to talk to other people, to maintain relationships with friends and family and the like, but we also had those costs and challenges of sometimes the technology didn't work, sometimes they didn't really understand it, sometimes they didn't have as much choice and control as they wanted, so a bit of a swings and roundabouts type one. What do we need more of, though? That's probably more important, and that was the 3 Ps I've got there. Preventing. There's very little other than maybe the call technologies about actually preventing the onset of loneliness. And there were occasional ways to do this. There are things like, is the care home in this case, is it accessible to visitors? Are people able to get there to see their loved one? Wasn't always an intervention that was looked at as much as I think it could have been. Things like the layout in care homes was quite important. And there's probably lessons in home care for this, I think. Again, are people able to get to their home to go and see their family member if they have one that wants to visit? Are they able to get out of the home, perhaps, if they are physically capable? Is there actually infrastructure there for them to get out and about? Similar. And there's lots of other areas you could think of in this general thing. That's just some examples. But also personalizing. I mentioned how personal loneliness is, and this wasn't something that was massively found that wasn't that much about in the research. It tended to focus on specific events, whereas actually, especially when I've talked to people in care homes, and perhaps it's the same for home care, those everyday interactions, those little personal things of little everyday chats are often more important for sort of boosting people's general well-being than having a sort of weekly event or something like that. It's also that personalizing thing has to incorporate consideration of that person's culture. There's especially in a care home, everyone sort of gets lumped together, and people who are in a minority population, whether that's through ethnicity, through sexuality, through being male to a degree in care homes as well, where there's a lot less men of that age, typically speaking, in care homes, can be quite a difficult experience. And things tend to focus on the sort of predominant cultures and more to work so people are these places are inclusive, is likely to be effective. I guess a bit different for you guys because people are in home care, they don't have that community so they're perhaps still in their original community. So that the other way to sort of look at it might be ways to maintain the links to the community around them, and things like that might be the sort of the way to go. And last but not least, being pragmatic, costs and resources. Definitely need more research on it, because a lot of the things I'm saying today, I'm well aware will take staff time, may take costs, and there needs to be ways of putting things into practice that don't always rely on that, because it's an inevitable pressure when you add that. And sometimes for staff especially, as I say, I've been a care worker, and I'm well aware that sometimes your time is precious and you don't necessarily have the time, certainly for some of these big things like this that we're talking about. We also looked a bit into the how. Do you want to ask what time is it? Have I got long? Perhaps I should skip through a bit faster.
So there's still time, 23 minutes, yeah.
Oh, still got, right, okay.
Yeah.
In fact, I will describe this slide then. This was looking about how
Actually,
interventions...
we can't see the slide, John.
Oh, I've been skipping through slides. Can you not see them?
No.
Oh, you're joking. I did not realize that. What has this been doing then?
Oops. I think we've just lost John there. There he comes.
Yeah, John has disappeared.
Sorry about that. I fell out the room then.
Right. Yeah. You're back in, yeah.
Okay, I'll try again to share the slides. Sure. I'm so sorry. I did not realize you couldn't see them all that time. Go to all that effort of making slides. Right, where am I? Get to the one I was at.
You just spoke about being pragmatic and
yeah. I will try again, see if it works this time. Okay, can you see that?
How? Yes, we can see that.
Okay. I'll just put it to the full slideshow. Can you still see that?
Not the full slideshow. We can see the slide, but not the full slide.
Oh. It should have been full screen. Is it better like this, maybe? Wouldn't normally.
It's okay. We can still see it.
Okay, I'll do it like that then. I don't know what happened there. Oh, no. There were actually slides all along. I apologise. You've been missing all those. I guess it's still...
you can share the slides. No, there's no one.
I will do. Yeah. Okay, right. So the how interventions can work is another thing we looked at as part of this review. We're still refining this in some ways, but we used something called Access, which is actually the World Health Organization have come up with it. It's a way of categorizing different types of interventions to do something about loneliness. Ultimately, this is how we sort of interpreted what it's doing. So firstly, we've got systemic facilitators. These are things like government policies, but also we sort of expanded it a bit to also refer to things like staff training, ways of thinking about how you do your care, the guidance systems in care homes, infrastructure like transport and things like that, and the resources that you have available. And there were definitely things in that area, like I've mentioned already. But ultimately, they tried to do things through these different pathways, which is the middle blue line. There was the ones that were most common were the social engagement ones that I mentioned before, which is just as I was saying, it's specific events where people get together and talk to each other in some way. So that is something that is aiming to have for people to have more or better social interactions as a way to get into less loneliness. There were two other types also ultimately trying to do the same things but through a different route. There was access interventions, and this was a bit more like the systemic things. Rather than having an event, it was a way of arranging the furniture that people might be able to talk a bit more easily, or it might be things like, I mean, these are care home related research, so ways where visitors can come into the building a bit better, it's a bit more easy to come visit, and these sorts of ideas. And there might be equivalent things in home care that are worth considering, but I'm not sure on that one. The other way is skills related interventions, usually forms of therapy to help people's social skills, essentially, so that they have a better capacity to have those more and better social interactions. It could, but the one that was somewhat different were therapeutic and psychological style interventions. These tend to have two different sort of ways of actually tackling loneliness. It could be about improving resilience, and that's about people feeling better about the relationships they already have. It doesn't necessarily directly change them, though it probably does result in changes to relationships over time, but it's just about appreciating what you've got a bit better, and therapeutic and psychological type interventions are better able to do that kind of thing if that's the problem that is in this particular person. Alternatively, it could be more general. They could be about improving emotional well-being. If the person is also suffering from depression, it might be more targeted towards that, but still can help loneliness because these are such intertwined issues. Sometimes it was even physical exercise. Getting the physical exercise sometimes had an effect on people that was the spark to feel a bit better, that could then result in less loneliness. Ultimately, these are always, horses for courses, as they say. It's about identifying the person and the route you want to take to less loneliness. And these were the sort of broad ways of which you could go down, just depending on that different loneliness that might occur in the individual. Ultimately, then, what do we need? On a general level, well, for all of us, it's about getting the right things for the right people at the right time, however that may be. But also, I think it's important to get it as part of wider planning. I've actually just been talking to another researcher who does a lot of research into transport, and these sorts of things are not really considered in transport policy, but it's really important to be part of it because we need to find ways to actually prevent people from being, further apart from each other. And transport could be one way. There could be lots of other ways. And they've got some ideas already. We're at an early stage. We haven't gone any further than this, but we've got 3 possible ideas of types of interventions that could be useful that we might actually go ahead and produce and send out to care homes in this case, but similar possibilities might be useful with care homes. Firstly, signposting. It sounds quite simple, but the idea is lots of events and groups and organisations do exist, but care staff and even managers don't necessarily know about them. They're often quite, they run in their own world a bit, so it's quite reasonable that people wouldn't know about them. So this is just about, okay, we can connect these groups together to the care organisations so that they've got this sort of list of, okay, this person might like this particular group or event or society that exists, and we can recommend it, and then wouldn't have to do necessarily much more. You might want to help them along or something, depends how capable, what needs to be for the person. Building on that idea is one that, again, we would possibly have to create as a research team, a general toolkit. It might include signposting, but it would also include advice on what are the best ways to sort of connect people together. We're focused on care homes, so it would be things like what is the best layout of the furniture, what are the risks of different types of layouts, how useful is allowing relatively freedom of movement for people who may have severe dementia, so you've got risks involved with that, but what are the benefits to it as well, and what's the best way to allow that safely as far as possible. is the garden used well enough? These sorts of things could be in the toolkit. Lastly, an interesting one based on some of the consultations. One of the care homes I went to had a specific well-being team, and maybe this is something some of you guys could consider. And this was about somebody having one person, or sometimes maybe multiple people, whose specific job is to think about, okay, or part of their job. Sometimes they had actually, it was their sole job for a couple of people, just to sort of focus on what is the best way to improve people's overall well-being, with quite a big focus on loneliness and social participation and stuff like that. And that had really changed a lot in the care home by having that specific person who's actually they can talk to the people in the care home. It's very personalized, find out what sort of things are best for all of them. They can target the people who most need it as well, and think, okay, this person's fine, we don't really need to do something for them, but this person is cut off, they're not doing well, we need to think about something we can do to help them. And so this was a really useful thing. Yeah, what about home care? So because I know you're a home care group, I decided to try and apply some of the findings to your specific situation, which is not one I've sort of had as much looking into, but I thought it'd come anyway, it's worth doing. So some of the key things for you guys might be the sort of questions you can almost ask yourself whether they are happening or not. And ultimately, it's down to you. It can be difficult. Little things like, firstly, how can existing connections be maintained? There might be things you can't control, like the transport availability and things like that. But there might be little things you are able to do. You might be able to help somebody use their phone to contact a relative or something. All these little day-to-day things that can just go as a little question, right? How can we make sure? Because existing connections can be so important. If a person has any at all, of course, they tend to be a much closer connection than ones you can just get going to a new group. So how can those existing connections be maintained? But people might not have those, so then it comes a question of, are new relationships needed? And then how can you get to creating those new relationships? There might be groups out there, events and clubs and societies that you don't currently know about that actually could be useful, which is why I tried to mention a few throughout the presentation, things like men's sheds. But as you may know, there's things like lunch clubs. Religious groups often have specific events and society that you can build around. There's all sorts out there ultimately, and it's whatever that individual is going to work best for them. And I'm aware it's not easy to sort of just go and do that, but just a useful question to ask, I think, at the self as a person trying to do that support.
Yeah, unfortunately, we didn't see that slide, John. I think it's very helpful to us, that one on home care.
Is it not? Can you not see the slides again? I don't know what's going on with this.
No, we can see them, but I think it would be good to actually have a look at the last slide you just spoke about on home care.
Yeah, I mean, I haven't got much about it. I've been mainly talking, to be honest.
Right. Yeah.
So the recording's probably your best thing. The slides are quite brief. There was intended to be a brief sort of over thing of what I'm talking about. I'm not sure why, because it says on my screen that I am sharing it and you should be able to see it. So I don't know what's happening there. I can only apologise. I've nearly finished anyway. The two last questions, that sort of useful questions maybe to ask yourself, or questions for researchers too. The second to last one is, how can the individual, in this case in the home care, be proud of what they've given to the world? A bit more of a different one that you might not think of as obvious, but that's about going back to the stuff, particularly with men, about that social sense of worth, where they've got something in there, some purpose still, or some pride in things that they've given to the world, is something that can actually be, if you can find that thing, it can be really useful for people's loneliness. It may not seem as obvious as the connections related stuff and relationships, but we're all social creatures. We all exist in the world. I think we all want to feel we've contributed to the world, and most of us do on some level, and that's a really positive thing, to be able to help somebody to realize what they've contributed to the world, even if it's small things. And lastly, what structural challenges do the people you support faced? Not necessarily can do anything about, but this is again thinking, actually, what this person really needs is a better bus service nearby, you know, and you can't necessarily make that happen, but it's worth being aware of. I think that actually sometimes there are bigger challenges that need to be do something about. And if it's something that a lot of people start to face, this is where involvement in our sort of groups or the co-production stuff you do as well is really useful, because you can bring, these are the actual challenges we face that we can't do anything about, and then you can bring that to them. I mean, I'll skip into the next slide. I don't know if you can see it, but ultimately it says I've got a lot to do yet in terms of my research, as you can probably gather. I've got on there my email, which you're all welcome to email me, or I've got a link to the NICHE LEEDS website. We've got all sorts of stuff on there. We've even got a virtual care home on there, which is particularly fascinating. There's also a link to join our mailing list if you want to know more about what we're doing, because we might be called NICHE LEEDS, but I think there's plenty of opportunity to get involved anyway, because it's not really just about leads, is it? Any of this stuff. So if anybody does want to get involved, you're more than welcome to look into that and how you can help, you know, make sure our research is looking in the right direction ultimately, whether that's to do with loneliness or otherwise. I will stop sharing. I don't know if you could see it anyway, but my slides, but hopefully I'll get Melody or someone to send those slides out after if you want to have a bit more of a look or a reminder. So yeah, thanks for inviting me, and any questions?
Wow, thank you so much, John. I mean, you've shared quite a lot of things and quite interesting. And it couldn't have come at any better time than this morning, actually, because we were with Silas at another meeting talking about digital inclusion as a program that can be implemented for, you know, tackle loneliness. It was actually this morning, and you know, I think I'll just cover some of the questions that I had so that we quickly go through this. So you did mention about the association between severe isolation and loneliness, and that women kind of tend to are more at risk of loneliness, and not actually men. I don't know if I captured that correctly. And my question actually was on, what are some of the things that make women that are severely isolated actually become more risk to loneliness than men? Or is it also just a matter of actually men not sharing their feelings as well? Is there anything that kind of brings out or mediate that kind of relationship? And the other one was also on some of the things that can be done to tackle these challenges, loneliness. I don't know if you've heard about the friendship bench. It's a concept that actually came from Zimbabwe. And there is actually a university in the UK that has been exploring that. It must be University of Sussex. But it has become a global solution, actually. Friendship bench. Probably you can have a look at that one. It's quite an interesting concept. And my interest actually is how can that be adapted into, you know, a setting like the UK. So the friendship bench actually, it's a bench in the community where there's usually a trained person who sits on the bench, and people in the community can actually just, you know, sit next to them and just have a conversation and all that. So these are actually trained people from the community. But I think it can be adapted as well in the UK. I don't know. So what we have kind of imagined ourselves, like it could be something online, and or it could be something, a bench put in the shopping mall. People become quite aware of it, and they can actually, you know, speak to trained people that are within the community. Yeah, but that's something to think about as well. And of course, the digital inclusion that we were actually discussing this morning. a face-to-face digital inclusion program where adults, older people can actually come together and just learn basic skills on using their phones, but also get on to access the community, learn about on accessing their health through NHS app, planning their journey, and all sort of things. But I acknowledge that you have also shared quite a lot of other programs, including virtual reality program, which is quite interesting.
Yeah. There's a lot to answer to there. Sorry, I made it 40 minutes long. I hope that wasn't too long, this presentation. As far as your questions go, I think with the men and women thing, I suspect it's the men that are most severely isolated. It's probably more that I won't say will sort of deny their loneliness. I think it's more about they don't tend to see their situation as one in which is lonely. I think they tend to see it a different way. And they tend to construct there's some research out there saying about constructing a concept of otherness and independence in solitary, being solitary, which I think is a big part of that, why that sort of relationship happens. But it doesn't necessarily mean they're fully okay, I think. So there probably is something that you might call loneliness with some of that group, and the evidence that they tend to suffer much more health problems, many with that social isolated and things like that, I think further suggests that just because they're not saying they're lonely, it probably doesn't mean that they're completely okay. I think it's probably what's happening there. The friendship bench sounds really interesting. It's a notion I'm a little bit aware of, but don't know a lot about. I think my general advice would be that if there's somebody out there who's enthusiastic and wanting to do some kind of intervention, it will probably help some people. So it's nearly always going to be worth doing. I suppose if there's a trained person on it, having the sort of resources to ensure you keep having that trained person will be a long-term barrier potentially to keeping doing it. But I think particularly people who do sort of aware that they're lonely and are likely to see that and possibly come up and chat, particularly older people who probably have a bit more of a culture than younger people of sort of chatting to people in the street, at least in current cultures. So I definitely think there's the scope for that working, especially if you've got somebody who's that enthusiastic person who will do those roles of being the one sitting there. Because I think the benches where you don't have someone where you can just say, sit here if you want to chat, I don't think they tend to be as effective because people can be quite anxious of going up to something like that. So I don't see them working that often when they're about. And yeah, is there a question from Margaret, by the way? I see your hand up.
Yeah, sorry, just want to say apologies for turning up late, but your talk was really, really interesting. We worked on a loneliness study, and we approached people we did it in care homes, we did it in the community, and like the questions that you were asking, and they will say no, I don't feel that I'm lonely. But then as you were going down and answering the questions, saying like, and how often do you speak to somebody every day, and how often do you go out and meet people, and then you sort of like thought you could see, yes, they were. And just from my experience, it tended to be more of the men that we spoke to came across to me. And your friendship bench, local to where I live, they have a bench and it's called a happy to chat bench. So it just has a little plaque on and it says, if you're happy to chat, sit here. And there are always people sat on it chatting away.
Oh, good.
Oh, interesting.
And
I didn't know that.
And it works. Yeah.
Okay, I found my skepticism was unwarranted then.
So maybe that's all it needs, just a a happy to chat bench. I think if you're going to put a professional on it, I think they'd have to be there all day, every day, to offer advice and places for people to go.
Yeah, that's fair enough. 'Cause I must admit, I've the happy to chat benches I've seen a bit more, and I've not tended to find that people use them much. But maybe it's a bit context dependent. Maybe where you are, there's just a bit more. It's maybe because I've tended to live in big cities, and it's a bit more. I think there's a bit more anxiety about doing that. Maybe I don't know if you are in a big city or not, to be fair, but maybe in certain areas that is something that people will be a bit more willing to do or something. There's probably need to do more research on that. But
yeah, that would be very good.
But yeah, I can see the benefit of having the trained person, but it does have the big problem of how much time would they be able to spend there? So Yeah, there's a research question in that of how much is that person needed, and how you know, it might be that actually in some situations it is really helpful and others it's not. I'm not sure, to be honest.
Right. Yeah. So, I mean, loneliness is a concept that's also difficult to measure. I really wonder how you guys are also measuring loneliness. Yeah, because I can imagine trying to measure it.
Yeah, I mean, it's a constant issue. I mean, a lot of the work we do is more sort of personable, those sort of long conversations with people, which is very different. We don't necessarily have to worry about a measure with that sort of thing. But when we are doing the bigger, sort of more statistical stuff or looking at it as a measurement, there's three sort of commonly used measures. There's a thing called the UCLA scale, which is, and in the indirect one I mentioned, actually, I think it's the shorter version has three questions, and it's like, how often do you feel left out? How good do you feel your companionship is? And I forget the third one offhand. That, as I mentioned, that does tend to find slightly different results to if you ask a direct question, because we do sometimes have a direct question of just how often do you feel lonely, and it does tend to come up with slightly different answers sometimes. So we have to be aware of those differences. And the third one is called the De Jong-Gieveld scale, which was developed in the Netherlands, hence the name. And it's similar to the UCLA one. It doesn't use the word loneliness in it, so it has some things in common. It's also a bit better for splitting up different types of loneliness, so it can be used for that reason, but it's not been quite as common as the other two in this country historically. But I think it might become the most common one. It's arguably the best, but it's very difficult to really say. And I think the real thing to do is to be aware of what the way the question is worded, how it might just change the results a little bit. Things like, as I've said, if you ask the direct question, men are coming up as less lonely than the other versions. I think awareness of actually just how the question might, in some ways, cause different responses is just the best way to go about it. And for people in situations like yours, more easy to sort of have those personable relationships where you can talk to someone and understand a bit more about who they are as a person, regardless of the kind of written measure, is an important part of it.
So I'm quite aware that we 2 minutes beyond time. Ade, do you have a quick question before we close the meeting?
Yes, I just want to just mention that I know from being a carer and an employer that our staff are the only people that interact with our clients on a day-to-day basis, and that loneliness is very, very severe in cases because we're the only social interaction they have. They don't have family members, they don't have anybody coming to visit them, just us or the GP or nurse in the time. Does this affect dementia at all? Because they don't have anybody to actually interact with. Does it hasten the dementia, or does it have an impact on them? I know it has an impact on their well-being and mental health, but what else does loneliness do?
Sadly, the research does suggest it can quicken the onset of dementia, make it happen sooner, essentially, and worsen how fast it develops. I think from what I've read, the reasoning for that is that part of, I mean, that's probably the social isolation element as well, rather than necessarily the subjective feeling of having conversations, having things that stimulate your mind almost, I think are part of what keeps your cognitive capacities sort of whirring, so to speak. And not having those is something that it very likely is a problem for making dementia certainly earlier onset of it's associated with, and quicker development of it. It's a difficult situation for you if a person doesn't have any friends or family. All I can say is I hope you do your best. Some of those questions I was asking, maybe you could have a think about different ways to stimulate things. In some cases, where people are already lack capacities, ways you can get them reminiscing about past things that they've done might just spark a little bit more to. It's not going to completely stop it by any stretch, but there might be a few little things that you're able to do a bit more easily than some of the bigger things, because I don't know how capable they would be of getting to you know, events and societies and clubs, they'd often may want support to get to them, and that's, I don't know if you'd be able to provide that.
No.
But
we're just there for maybe 30
yeah.
minutes, an hour, and then we have to leave. And I just say, okay, that's to be mindful to make that a quality time spent engaging with them, stimulating their brain, engaging in conversations, and doing as much as possible to stimulate the cognitive part of their brain during that period.
Yeah, I think that's that quite possibly is the only thing you can do.
Yeah.
But yeah, I mean, all I can say, I think, is good luck, and you know, fair play to you for trying, because it's a very difficult thing to do. So it's really good to see people out there, you know, thinking about it, you know, how they can do it a little bit better. Because, you know, I've worked in care as well. It's hard. It is really hard to sort of go and do these things. So yeah, thank you for doing it.
Thank you.
All right, I think we are beyond our, you know, scheduled time. So unfortunately, we can't take any more questions. There's a lot that we could have asked because you've shared a lot of things, John. But unfortunately, I have to close this meeting. Hopefully, we can still connect. We've got your email. We'll share your slides as well, so that other people who may want to connect with you can also send their emails to you.
Yeah,
thank you so much for coming in, and
thank you
for this presentation. Thank you so much.
No, thank you all, everyone. And please do get in touch with me or Stephen if you want to get involved in the Homepage project. And
yes, sure.
We love to keep chatting to people around the sector, as it were. So don't hesitate.
All right. Thank you so much, everyone, for coming in. Thank you so much. Let's meet again next month. Bye.
Bye.
Bye.